Hi, everyone. Welcome to Cyber Review. Today, we have an exciting book to talk about. We have Matthew Webster. He's the author of Do No Harm. So, welcome, Matthew. Thank you for joining us today.
Thank you so much. I'm happy to be here.
That's absolutely great. And thank you for writing this amazing book. So, why don't you tell us a little bit about your background and what inspired you to write Do No Harm?
Sure. So I've been in the cybersecurity industry for a very long time. I know I look like I'm 20, but I'm a little bit older. Um, but I've been in and out of healthcare from a variety of different angles for many years. I've done federal level cybersecurity. I've done state cybersecurity in healthcare. I've worked for a what's called a regional health information organization as well. So I've got some background from that perspective. And I've also worked with a lot of hospitals and things like that from a cybersecurity perspective to point out a lot of the flaws and the challenges related to medical device cybersecurity. And quite frankly, this is an interesting topic to go into, because if you talk about a typical organization, you need a firewall, you need antivirus.
Yeah,
It's,
but
it's
this
kind
is
of boring.
critical.
Yeah, it is kind of boring. But this one, the IOMT devices have so many flaws in them that it's a fun topic to dive into and have a conversation about because I think most healthcare organizations have a tremendous number of issues because they've got these IoT devices, Internet of Medical Things, if you want to use
Can you
IOMT.
walk us through about real world risks where cyber criminals or nation states they are targeting devices, medical devices?
Sure. So the book is actually much broader than that because I cover data in all its different forms. There's a whole bunch to go into. I talk about the legal landscape and so on. It was quite a bit of fun. But to target in on your specific question, because I want to make sure I'm being careful with that, I think it's also important to understand the context a little bit. Because when you're talking about nation states, there is a lot of blurring of the lines. And so a lot of people think, oh, you got the hacker in the basement, and they're doing it. That is couldn't be further from the
Yeah,
truth.
true.
Maybe less than 1%. I'd say far less than 1% where that's going to be true. A lot of it times you've got organized crime or you've got a nation state attacker. But what's happening, and it's been happening for many years, is the nation state attackers are actually going in and bringing in those organized crime to do their work for them because that gives them plausible deniability. So they're sometimes paying them behind the scenes. So you don't always have a trail with that. And when you're trying to attribute it back to a specific nation state, it's hard to do. So you don't always know what's going on in the background. And even that part of the equation is interesting because sometimes you have initial access work that's being done by some types of cyber crime gangs, but then other ones are going to be dealing with the actual ransomware. So sometimes you can go purchase this stuff right on the dark web to be able to pull that information in. So there's a lot of challenges there. The other side of the house that I think is very interesting, and there's very few exceptions with that, where the information is out there, they'll post it, but they're going to say, hey, here's a new FBI report. And hey, we're working together with the Cybersecurity Infrastructure Security Agency. And they provide that information, but that information is like, hey, we're seeing this attack in this particular sector. So, for example, there's been a lot of different cases. Like, for example, North Korea was targeting a lot of the US hospitals
Hmm.
via, and I'm not sure exactly how to pronounce that, but I think it's pronounced Maui
Hmm.
ransomware.
Hmm.
And so you hear the over what's actually happening, but you don't have all the details of how it's actually impacted all of the different hospitals. In some cases, what you're finding, like for example, when the US was starting to send tanks over to Ukraine,
Hmm.
that caused a lot of Russian cyber attacks to
True.
go against US hospitals. Now, this was through a group known as Killnet, and they're using what's called a distributed denial of service. In
Hmm.
case some of your viewers may not be familiar with that, that's where you send a lot of data over to one particular system.
Target. Yeah. Hmm.
Yeah. And so that becomes a big challenge for organizations because you're overwhelmed with that. Now, there are defenses against that, and some are going to be pretty good, but a lot of hospital systems in that particular case were taken offline. I've also seen a report that everybody's used to, like United Healthcare, has heard about the
Hmm.
Change
True.
Healthcare incident. That you weren't hearing that originally, but there have been some reports that they have said that they believe that it's a nation state actor.
Yes.
That's
Yes.
like the biggest example right there. if those reports are believed to be true.
So another thing that you mentioned in one of your chapters is that you highlight the tension between innovation and regulation. So how can healthcare organizations strike a better balance?
So I think that it depends a little bit on the context, because you have to take a look at an individual system. If you've got an imaging system and it's multi-millions of dollars, do you want to just replace it every year because the patching isn't done? They decide not to do it for that particular system. It's not really a good investment. For me, I try to look at things from a reasonable standpoint. What is the ROI? What are the options for being able to implement something? Because security, we need to be a friend of the business. We recognize that these are big challenges. We recognize the context for where the business is at, and we try to create reasonable solutions. So in some cases, you're going to use something called subnetting, and you put in firewalls for each individual, in some cases, systems, I think is the best way to go, but at least try to bracket off these individual systems. But for example, when you're looking at some of them, some hospitals can have 10 to 15 different medical devices per bed. This is the vast majority of systems that are out there. If you've got 200 beds, that's a lot of IoT devices.
Exactly, yeah.
So I think you have to really take a look at the context, take a look at the systems that are compromised the most often, maybe separate those off, like imaging systems and patient monitoring and medical device gateways tend to make up the most attacked systems that are out there. And one of the things the Biden administration put out, and this was after my book was out, they did talk about creating letter grades related to IoT devices. And I think that's brilliant, because if you're going in and you have to analyze every single system, that's a lot of work related to the security team. There's a cost associated with that. And I think most people would agree, if you can't patch a system or they have a built-in password, you're not going to give that an A grade.
Yeah.
But these are the common types of problems that are in a lot of these IoT systems. So that's what I would start to take a look at and say, hey, how can we reasonably approach this? What are the problems with the existing IoT devices? And what's a great way to make sure you don't create the problems in the future, or to mitigate it in a least cost fashion?
Yeah, that's great. And I also know the Japanese, they also have this IoT ranking that they put a label on if they have been shipped with the default secure password or the firmware is updated. So my next question and last one is for everybody to know where they can get their book and how they can reach out to you.
Sure. So the book is available on Amazon. And there are other booksellers as well, but most people are familiar with Amazon. You can download it. They're going to be happy to sell it there. But in terms of getting hold of me, I'm very active on LinkedIn, so you can find me there. I do have my own company, Cyvergence, so you can go to cyvergence.biz and find some contact information that way. So there are lots of different means that you can use to get hold of me.
That's amazing. So thank you so much for your time, Matthew. And thank you for writing this amazing book to keep everyone protected in the healthcare industry.
Thank you so much. I appreciate it.
Okay, bye.